back to the East Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, share, and subscribe. And please do come back for more.
All
See
right,
you
let's
soon.
just jump right into this explainer. Today, we're taking a look at a topic that, frankly, is often surrounded by way too much silence and stigma. We're talking about erectile dysfunction, or ED. But we're going to clear the air here and break down the actual structured science, the biology, the mechanics, and most importantly, the actionable solutions. Now, right off the bat, look at this number. Research suggests that anywhere from 10 to 50% of men experience ED, especially those over the age of 40. Think about that for a second. That means this is a highly common, incredibly normal physiological issue. It is absolutely not a personal failing. It's heavily researched, totally understood by the medical community, and, as you'll see in just a bit, it's highly treatable. But before we get into the how to fix it part, we really need to define the clinical threshold here. What exactly are doctors looking for? Well, they're looking for a persistent difficulty that lasts for more than 3 months. So we're not talking about a single day where you were just exhausted, passing stress at work, or maybe a quick argument with your partner. It's a persistent state that's actively affecting your sexual well-being. So to understand why this happens, we kind of have to look under the hood at how erections actually build. It's basically a complex 3-step biological chain reaction. First up, your brain collects sexual cues and fires off signals down your nerves. Second, the blood flow takes over. Your body releases a chemical called nitric oxide, which relaxes this tiny smooth muscle and just opens up the blood vessels. And third, your emotions literally have to be in a relaxed state to even allow this brain nerve response to happen. It's like a line of dominoes. If any single link in this chain breaks, the whole system just halts. And when that system does halt, the root causes generally fall into 2 distinct buckets. I like to think of it like a computer. You've got the physical causes, that's the hardware of your body, and then you've got the psychological causes, that's the software of your mind. Let's start by taking a look at the hardware. Physical causes almost always come down to your body's plumbing or wiring. For example, high blood pressure or heart disease can literally narrow your blood vessels. Diabetes is a massive disruptor because high blood glucose actually damages the tiny microvessels and nerves that are absolutely crucial for a firm erection. Then you've got nerve damage from things like spine injuries, hormone imbalances like low testosterone, side effects from certain medications like beta blockers or SSRIs, and of course nicotine, which just directly wrecks your vascular network. Now, on the flip side, let's talk about the software, the psychological disruptors. Things like sexual performance anxiety, depression, unresolved relationship conflicts, and just chronic long-term mental exhaustion play a huge, massive role here. Why? Because these factors push your nervous system into a state of panic or stress. And when your body is stuck in that stress mode, it leaves the nervous system zero time to relax, which actively blocks those brain signals needed for arousal. But, it's rarely just one or the other. Most guys actually experience a messy mix of both. Think about it. A single physical failure, maybe you were just overly tired one night, can suddenly trigger this vicious cycle of psychological worry. You start overthinking, right? Is this going to happen again? And boom, that creates performance anxiety, which makes the very next attempt even harder. It literally blends the physical and the psychological into one frustrating loop. Okay, so how do we fix this broken chain? Doctors actually use a highly structured, stepwise diagnostic roadmap to figure out exactly where the system is failing. First, they do a deep dive into your medical history, checking symptoms, meds, emotional state, the whole shebang. Next is a physical exam to check your circulation and look for any hormone clues. Third, they run lab tests, like checking your fasting glucose for diabetes or running a lipid profile. And finally, if the picture still isn't super clear, they can use specialized tests, like a penile Doppler ultrasound, to get a really close look at the blood flow. Now here is an incredibly simple but frankly brilliant diagnostic clue doctors use: your sleep cycle. If you are still waking up with normal morning erections or having them at night, it means your physical hardware actually works just fine. That's a massive clue that heavily points towards psychological causes, like stress or anxiety, as the real culprit. But if those morning erections are totally absent, well, then the doctor is going to look much closer at a physical, organic problem. So, once we have a diagnosis, we move straight to treatment. But before anyone reaches for a prescription pad, doctors strongly emphasize these 4 lifestyle changes as your absolute first-line defense. We're talking about maintaining an ideal body weight and metabolic health, getting in some regular cardio, quitting smoking and cutting back on the alcohol, and finally, fixing poor sleep patterns. Seriously, these steps can rapidly improve your blood flow, protect your vascular network, and honestly, in milder cases, they can resolve the issue entirely. Now, if those lifestyle tweaks aren't quite cutting it, we look at the medical options. And it's really a tiered medical roadmap, which just proves that if standard pills don't work, there are highly effective backups ready to go. You've got your first-line medications like sildenafil or tadalafil to boost those blood flow signals. You've got therapies like cognitive behavioral therapy to help rebuild confidence and connection. For guys who can't take pills, there are devices like vacuum pumps or injections. And finally, for the most severe cases, surgical options like penile implants provide a really reliable long-term solution. I do have to pause here for a critical safety warning, though. If you are going the medication route, safety is paramount. These oral medications aggressively manipulate the blood flow in your body. Because of that, they must never, ever be used with medicines containing nitrates, which are super commonly prescribed for heart disease. Your doctor has to carefully review your chart to make absolutely sure you avoid this dangerous interaction. No exceptions. And actually, speaking of heart disease, take a look at this powerful quote from the literature. Because penile blood vessels are just so incredibly narrow, they often stiffen and clog long before the larger arteries in your heart do. What does that mean? It means ED can be a vital, flashing early warning system for your overall vascular health. So you see, it's not just about sex, it is quite literally about the health of your entire cardiovascular system. As we wrap up this explainer, I want to leave you with this provocative thought. Something to really chew on and maybe discuss with your doctor. Is your ED actually a warning sign for your heart? Could addressing your erectile dysfunction not just improve your relationships, but potentially be the key to saving your life? It is a powerful reason to never, ever ignore the signs. Thank you so much for joining me as we broke down the signs today. Stay curious and please stay proactive about your health.
Please subscribe.